Alright, we have reviewed our physician's orders, and we have an order for trach care, cleaning, and suctioning. So I've performed hand hygiene. I'm identifying my patient using 2 identifiers. So before we set up, and I've explained the procedure to the patient. Before we set everything up, I'm making sure that my patient is hyperoxygenating. This has to be done for at least 30 seconds prior to and after suctioning. Our wall suction is set on 120 to 150 millimeters of mercury per adult. If it were a child, it would be per hospital protocol. So we performed hand hygiene, and now we're ready to set up our sterile field. Only touching the outer portion of that, and we're going to put sterile normal saline in our box. So we're going to lip it into the trash and pour it in there. And now we're ready to put on our gloves. Okay, only touching the cuff link. Alright, so now we're ready to get all of this, and I'm going to wrap it in my dominant hand. That's the word I was looking for. Alright, and now we're going to attach it to suction. So I'm going to take my non-dominant hand, and this will now be my dirty hand. We're going to get it hooked up here. Okay. And before we can do anything, we've got to attach, or make sure that the wall suction is actually on. So we're suctioning, and we're getting all the saline in our tube. And now we're going to go to our patient. So she's been hyperoxygenating for 30 seconds, so I can now remove her oxygen. And I'm going to place it into her trach until you meet resistance or until the patient coughs. And we'll suction intermittently for less than 10 seconds. And then we will hyperoxygenate after. And so if we needed to suction some more, we would clear our suction, hyperoxygenate, and go in, and we would do that until the patient was clear. So now that we've suctioned, we are finished. We can throw everything away, remove our gloves. Throw all this away. So now we are going